600,000 residents living in Vermont, an estimated 72,000 adults and 6,000 children suffer from serious mental health problems. With this statistic in mind, we asked members of the MUHS community, do you know anyone who has a mental illness?
Yes. Yes.
Yes.
Yes.
Yes.
Sure.
Yes.
Because this is such a widespread problem, many people simply assume there is adequate care. We also ask students and teachers,
Do you think that there are enough resources for mental health patients in Vermont?
Yes. Well, there might be, depending on the illness.
No.
Yeah. Definitely.
I would believe so. I don't know that much about it, but I believe so.
Absolutely not.
Depends on the mental health issue.
It seemed that most high school students feel there is, in fact, enough care and support. Considering that suicide is the third leading cause of death in young adults ages 15 to 24, this attention is necessary and possibly not enough.
So there's a transitional youth age between 18 and 22 where I think Vermont and other states have identified that there's a real gap in services in general for this population, because all of a sudden you've left home, you're on your own, whether you're in school or you're working independently in the community, and to try to navigate the healthcare system, trying to navigate, just how to access treatment of any kind. It's much harder at that age.
The transition from high school into adulthood is often overlooked and can be life-altering for many individuals. Young adults are going from a very sheltered environment to the less sheltered adult world. Counselors they once had access to for free, like Brooke, are no longer available. There are counseling options, but most are expensive, with one session with a psychologist ranging from, on average, $75 to $150.
CSAC, the Counseling Service of Addison County, is a large and diverse organization which offers a wide variety of professional mental health and developmental services to the local citizens. In addition to many of these local, more decentralized centers, there are also 11 facilities across the state which offer inpatient care.
There was a day when any mental health problem was addressed by commitment to the state hospital, then at Waterbury. But over time, people realized that that wasn't the best setting for everyone, and so we moved to a community-based approach. We're having some problems though now because the state hospital is not adequately staffed, the new one in Berlin, and a lot of people with mental health issues are finding themselves in emergency rooms in the general hospitals around the state, and that's less than ideal.
It's not a Vermont issue, it's really a national issue. And I think it's like a lot of issues, it's got two sides. I mean, the great thing about decentralization is if you have mental illness, or your family or friends have mental illness, and they've been in an institution, institutionalized, living somewhere, and there's a way to get them out, that's what we should all want. Yeah. And actually I went to school in Tennessee, and spent time at the state hospital there. That was in the 80s, and they used to have 5,000 residents, 5,000 people at the state hospital. That's almost as big as the whole town of Middlebury, not quite. And now there are a couple hundred because they've decentralized them. So they've gotten these people out. And when I started here, there was the training school in Brandon. Another example, I don't know, there were a couple hundred people down there. It's closed. There's nobody there. So for those folks who were living in an institution and are now out in the community, that is a great thing. The flip side is maybe there are a very small number of folks who need that sort of support, need that environment. And so, maybe instead of going from there were 5,000 to none, there's something in between that makes more sense.
It's become more and more of a problem locally since the state hospital closed down. So it used to be that there was a facility, and it wasn't ideal by any stretch, but there was at least a facility. Since that closed down, it's been much harder. What it means is that a lot of people who are suffering from mental health crisis have to be housed, for want of a better word, warehoused almost, in hospitals, facilities that aren't really well equipped to deal with them. sometimes people are restrained for long periods of time. You know, they could be strapped to a bed for days at a time, medicated, and you know, the facilities are doing their best, the medical professionals are doing their best, but it's not what the institutions were set up to deal with. So it's creating a tremendous strain, and there's a lot of pressure to get people back out into the community, which for a lot of people suffering with mental health, that's a great thing, so that they can build connections and feel integrated. Their lives have more meaning, but for some people, it's very dangerous.
In times of state crisis, like following the devastation of Tropical Storm Irene, the demand for help is more than the facilities can handle.
We were kicking along and getting by. It was stressful, but we were getting by. And then after Irene, it was like someone hit a switch, and there simply are not enough beds. Let me just give you the examples. Pre-Irene, we never had a patient in our emergency department for more than 12 to 24 hours waiting for a bed. If someone waited more than 12 hours, it was extraordinary. Unheard of. Now we routinely board patients.
Yeah.
So, and when I say board, I mean they live in a room in our emergency department for days and days. I think our record is, 20 days now.
Let's take a comparative example. If I was experiencing chest pain and I went to the emergency room, I would get immediate treatment in the emergency room, and I would be immediately admitted to the hospital, to the intensive care unit. If there was no bed available, they would make one available. In the case of mental health, if I'm experiencing a crisis, if I'm suicidal, and I go to the emergency room, I'm told there's no bed available.
When facilities are full, individuals seek help on the local level, including ERs and local hospitals, which are often unequipped to handle their situation.
I would just ask you all to think about, I think a key point here is that we treat mental illness differently in our society than any other illness, okay? If you break your leg, I won't put you in the safe room and say, well, we can fix it in a week. We won't do that to you. I promise. If you need your appendix out, if you have a heart attack, we won't put you in the room and say, well, we really don't have any beds, we don't have the resources. We'll make it happen. That's what happens. Mental illness is different. And I don't know how it evolved this way. It's never made sense to me. We don't do this with any other serious illness or injury where we say, well, we just don't really have the resources today, and we may not have them tomorrow, and maybe not the next day. And chronically under-resourced these sorts of services. It's bizarre.
Yeah.
And frankly, I think we should be ashamed as a society.
For one individual, Patrick Fennessy, the lack of resources proved deadly. After serving a minimum sentence for trespassing and burglary, Fennessy should have been free to leave the Southern State Correctional Facility. However, he proved too unstable to survive in the outside world and landed behind bars several times.
In my experience, crime is related to three main things. There's kind of an intersection with poverty, mental health, and addiction. And often those three things are interwoven. And crime is very, very frequently, very consistently mired in those three things. One, if not several of those things altogether. So I'd say mental health is a huge piece of the crime puzzle.
Fennessy struggled with severe bipolar disorder and had attempted suicide many times. When his insurance ran out, he was forced to leave the Brattleboro retreat and was sent back to the correctional facility. A release plan was proposed for Fennessy, but then suspended. At just 34 years old, Fennessy had already run out of options. At 7:38 p.m., April 23, 2015, Patrick Fennessy committed suicide.
I just don't think that jail was the place for him. I think he needed to be in a hospital. But he was my best friend for a long time. And our son is never going to get to know him. And I just pray that nobody else will have to feel like this.
We used to send a lot of people to jail for a lot of different things, and these sorts of things happen. And for those of us, who are here in the acute setting with a patient, and you just have nowhere to put them, jail always seemed like a convenient place to go, because our vision was, well, what could be safer than jail? And actually, it's really not a safe place, and it's particularly not a safe place for an individual with mental illness.
Fantasy is just one of the many people who fell through the cracks of our existing mental health system. This problem is only getting worse. The cost of attending facilities is increasing, the number of people willing to staff these facilities is decreasing, and a spike in substance abuse, particularly opioids, has led to a rise in the number of people looking to attend these facilities.
What the ER docs and nurses and staff think about when we talk about this issue is the patient who comes in violent, agitated, needs to be restrained and sedated, and then settles into our safe room where we have a sheriff and a sitter, and then it can take days to move those patients to the proper location.
Let's face it, it's not the easiest job in the world. There are incidents of violence, of unmanageability.
The weak point comes down to two things: money and, let's call it, stigma.
Services are not inexpensive. They require trained professionals and a lot of intensive care and treatment. And the need in Vermont continues to grow.
Everyone we interviewed knew someone who struggles with some form of mental health problem. This is an issue that affects all of us, although on varying levels. What can be done to remedy this problem? How can we keep Vermonters from running out of care options like Fantasy did?
As voters, you have to think, what do you want Vermont to look like? What do you want your future Vermont to be? And I think that, healthcare across the board needs more funding.
It's always a bit of a budgetary stress to pay someone to sit 24 hours a day. We could use some more resources, but we're getting by.
So do you think that education about mental health in general would start to help those people?
I think it would go along.
Okay.
Absolutely. Yeah. I think everybody should be. I think it's definitely a good thing to know. To be able to recognize it as well, so that you recognize it in yourself if you're kind of being drawn into a mental health issue, if you're moving towards that, and to recognize it in other people.
The ultimate goal is not the provision of a mental health service, but the successful integration or reintegration of everyone into our daily lives and communities. I've often said that with our shrinking workforce, with our aging population, with the demographic pressure in our state, we need everybody engaged. We need to ensure that those with disabilities, the elderly, those who've suffered from mental illness can be a part of our workforce, can be taxpayers, and can contribute meaningfully to life in Vermont.